It's hard to stand here after Mr. Chen, but I'll do my best. Remember, I'm not a keynote speaker, I'm bringing greetings. So I bring you greetings from the Nurses Association of Jamaica, officers, executive, and general membership. Congratulations on hosting this conference under the theme, Reviving Healthcare, Reimagining Healthcare Innovations and Solutions for a Healthier Future, one which is quite relevant and topical at this time. We exist in a space and time when change is unavoidable. We are forced to come out of our comfort zones and adjust to the changes around us. Technology changes, climate changes, construction changes, illness changes and patterns, travel, all these areas and more have had major adjustments to how they have been managed in the last century. And as humans, we are expected to change in order to survive and exist. Healthcare delivery is no different and quite relevant at this time. People are living longer, and the general quality of life has changed for the better. To revive means to make new existing things. At this time as a country, the mandate of the Ministry of Health and Wellness includes reviving. There have been major changes to various aspects of the management of healthcare delivery here in Jamaica. These include, but are not limited to, the following: primary and secondary healthcare renewal, telemedicine in some sorts, prescriptive rights to our advanced practice registered nurses, electronic medical records, as you would have heard Mr. Chen speak of, public-private partnerships, improved infrastructure and aesthetics, vaccine management, procurement, and human resource management. And there are other areas of process management that are in the pipeline for changes. All this to ensure that our systems remain relevant and meet the needs of our population. The word reimagine means to form a new concept of, or to recreate, as defined by the Merriam-Webster Dictionary. In other words, it means to have a new idea about the way something should be done. The concept of healthcare delivery is a prime action area for this terminology, as we acknowledge the importance of adjusting the healthcare landscape to meet the growing needs of the seekers of healthcare. We exist in a global space where things move at a much faster pace than they did a decade ago. We must remain relevant and not get left behind. This involves education and training of personnel to ensure that practice standards are relevant and trending in keeping with international standards. Innovations speak to new methods, ideas, or products. Again, the changes that have taken place in the technology landscape have forced us out of our comfort zones. We must employ new ideas to get the desired results. Time becomes important for us. We must ensure that clients are in receipt of optimal care. We must be ready to utilize new methods, new ideas, and new products in order to maintain our relevance in the global space. Our clients expect us to meet high standards as they empower themselves with current trends and information in healthcare management. How we treat our persons who seek healthcare must evolve if we are to achieve desired mandates. As we look to the future, we acknowledge that change is inevitable. Healthcare delivery has evolved, and we must reimagine our systems to ensure that the future of healthcare delivery remains a priority. It means that all stakeholders will have to join forces and meet at a mutual place to ensure that the end user of the product is satisfied. We have to increase training, procure relevant machinery, build safe, appropriate infrastructure, empower both staff and clients, and most importantly, We must ensure that we all have a shared vision. No one individual or group can ensure that we have adequate healthcare innovations and solutions for a healthier future. It will take a combined effort. The 3 C's of life tells us that you must make a choice to take a chance or your life will never change. This becomes quite relevant if we are to make ourselves ready for the future. The future depends on you today. So today, we will do what is right and necessary so that we will be ready for the future. Those are my few words. I thank you. I don't know if anybody is willing to ask me any questions, because I didn't do a presentation, really. But if there's something that I may be able to speak to or answer, Dr. Ewing said he had a question for me, so I don't know. We can have a conversation if you so desire. If not, I'll take my seat. Right. All right, so thank you. Anybody else? Okay, thank you.